Hello, I'm Dr. Sam, this is Dr. Sam's Health, and we continue covering COVID-19. First of all, today is Easter, so let me wish you happy Easter if you celebrate it. And of course, I think today is the perfect day to talk about social distancing and flattening the curve. I realize that a lot of people are either disagreeing with this idea of social distancing to flatten the curve, or are simply not aware of this concept, so let's talk about this today. Before we begin, I have to make one huge disclaimer. I'm a practicing physician and I'm going to talk about a huge medical or public health issue. I don't want you to take anything I say as a medical advice. It's not intended to be such, and it is not. Effectively, everything I talk about in my videos, in my blogs, and my website is public education, and if you need a real medical advice, please go to your family doctor or to the nearest emergency room if it is an emergency. And now we can talk about flattening the curve and social distancing. First of all, what is the curve that we're talking about to begin with? There are several kinds of growth curves that we observe in nature. For example, we can take a petri dish, put some bacteria in it, and see how they grow. And typically they grow almost exponentially, and I say almost because actually there is a proper term for this curve, the growth curve, which is called the logistic growth, which simply means that bacteria initially will grow exponentially, but then due to certain environmental limitations, there will be certain deflection of this curve and the bacterial growth will slow down and stop. We also observe very similar curve when we're talking about epidemics or pandemics. So we've got our patient 0 who transmit the virus to 2 or 3 people. These 2 or 3 people will transmit it to further 2 or 3 people each, and the number of infected cases will grow exponentially until a certain point when there are pretty much not too many people left to contract this disease. So the spread of the virus will slow down. The problem with that is that currently we're located in the exponential growth portion of the curve. And accordingly, the number of serious cases, the ones that require intensive care units, the ones that require hospitalization, the ones that require ventilators, a lot of intensive care, will also grow exponentially. Whereas our medical system has its limits. It has certain capacity to provide care to a certain number of people. We've got limited number of beds, limited number of ventilators, limited number of staff. So if we let the virus spread exponentially, very soon we'll face a situation like Italy did or Spain did, when we literally do not have enough capacity to treat all these patients. Unfortunately, there are places in the world right now where doctors have to decide which 1 out of 5 patients will receive a ventilator. And accordingly, this one will leave and the rest 4 likely will die. This is a very tragic situation and we want to prevent it from happening in other places. So how can we prevent this situation from happening? The answer is, if we manage to slow the spread of the virus, we'll effectively change the reproduction number of the virus, or we'll change the multiplier part of the exponential growth. By that I mean that the number of cases will not double or triple every several days, but it will go up by a much more moderate factor, something like 1.2, 1.3. Effectively, it will mean that the exponential curve will be actually much more flatter. So we will flatten the curve. What is the advantage of this and what's the goal of doing so? There are several good things about that. First of all, we will not end up in a situation when the number of cases grossly exceeds the capacity of healthcare systems. We will still be able to provide all patients, or the vast majority of them, with proper care. The second good thing is that we will buy ourselves some time to get prepared to see these patients. We'll get better equipment, more equipment. I know that some companies are manufacturing ventilators right now. Lots of companies are manufacturing personal protective equipment. The hospitals can stock this kind of equipment and use it in case it is necessary. And it's already necessary, but we anticipate that the peak of this pandemic is still in the nearest future, so there will be moments when we'll need much more of the supplies that we have right now. So right now we can buy time, we can get more supplies, we can train personnel. Some places are actually building hospitals to treat COVID-19 patients specifically, and that also takes some time. Also, we can try different treatments and see if they're effective or not. We can also work on our vaccines, we can study the virus better, we can develop new treatment strategies in general. So overall, if we manage to flatten the curve somehow, will be much better prepared to deal with this situation, and the outcomes will be much better because we will be able to treat more people more effectively. So the last question is, how can we achieve this kind of result? How can we flatten the curve? And the answer to that is social distancing. Actually, I don't like the word social distancing because I think it's a misnomer. We're not socially distancing from other people, we are physically distancing. We are creating a physical barrier between us and somebody else, and we're reducing the risk of transmission or contracting this virus. And actually it goes both ways. So we are reducing the risk of contracting the virus, and we're reducing the risk of spreading the virus if we are, say, asymptomatic carriers. So realistically, what can we all do? First of all, we can limit our trips outside of our home. Unless you are an essential worker, I happen to be one, you don't have to go to too many places. Likely you have to get some supplies from grocery stores, maybe you have to go to a gas station here and there, but you can limit the number of trips first. Second thing, if you live in a household, there are several people, you can just dedicate one person who would go to this kind of places, preferably the youngest and the least susceptible or least vulnerable person. Second thing, even if you go to these places, keep your distance from other people. Like, the recommendation is 6 feet or a couple of meters, which is a safe distance. Third thing you can do, you can wear personal protective equipment like masks. You can also wash your hands, because likely, no matter what you do, if there is some virus somewhere in the environment, it will sediment on certain surfaces that you will touch. So it totally makes sense to wash your hands, not to touch your face, to sanitize surfaces in your own household. What I personally do every time I come from work, I actually put my clothes aside, and in order to get them cleaned and sanitized, and I take a shower right away. So things like that will prevent or slow down the spread of the virus, and they will protect you and your families. And effectively, they will protect the whole community. There is obviously much more stuff we can talk about, but today I wanted to focus on just one aspect of this pandemic, which is flattening the curve, and I hope that it was convincing enough that this exponential curve can be flattened, and that will give us some break and some time to prepare better. And collectively, we can realistically flatten this curve by doing very simple things. Limiting our contacts, distancing, using personal protective equipment, sanitary measures. So that's it for today. I hope that you will be able and willing to follow these simple guidelines. You'll be able to stay safe, and you'll be able to protect your families. I will keep covering this subject, and there will be more videos on COVID-19 and things that we can realistically do to protect ourselves. And if you don't want to miss a thing, check out my website, drsamshealth.com, subscribe to my YouTube channel, hit the like button, ask questions, make suggestions or recommendations for future videos. You're always welcome to chime in and to interact with me in any capacity. Once again, happy Easter to all of you who are celebrating it. Otherwise, in general, for everybody, stay safe, stay healthy, protect yourself. All the best. I'll see you in my next video.